Econazole foam is a medication used to treat athlete's foot. It contains an azole antifungal that works by stopping the growth of fungus. It is recommended to apply the foam to the affected area once a day, preferably at bedtime, for the best results. Before using Econazole foam, it's important to read the patient information leaflet and instructions for use provided by your pharmacist. This medication should only be used on the skin, so make sure to clean and dry the affected area before application. Shake the container well before use, and apply the foam on and around the affected area as directed by your doctor, usually once a day. It's important to avoid smoking or being near open flames while applying the medication, as it is flammable. Remember to wash your hands after using the foam and do not wrap, cover, or bandage the treated area unless directed to do so by your doctor. Ensure that you do not apply the medication in the eyes, nose, mouth, or inside the vagina. If the foam gets into any of these areas, flush with plenty of water. Use the medication at the same time each day to get the most benefit from it, and continue using it until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If your condition lasts after 4 weeks of treatment or gets worse, be sure to consult your doctor. If you experience burning, stinging, irritation, or redness at the application site, it's important to tell your doctor or pharmacist. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. If you're allergic to Econazole or other azole antifungals, or if you have any other allergies, make sure to let your doctor or pharmacist know before using this medication. This product may contain inactive ingredients that could cause allergic reactions or other issues. It's important to discuss your medical history with your doctor or pharmacist before using this medication. Before undergoing any surgical procedures, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, use this medication only when clearly needed and discuss the risks and benefits with your doctor. It's unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware that Econazole foam may interact with other medications, which could affect how they work or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. If Econazole foam is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It is important to keep this medication out of reach of children to avoid accidental ingestion. Always follow the recommended dosage and storage instructions to prevent any potential harm. This medication is for use on the skin only. Clean and dry the affected area before applying the foam. Gently massage the foam into the skin. Use this medication usually twice daily or as directed by your doctor. Dosage and length of treatment are based on your medical condition and response to treatment. If you are using this medication on the groin, wash the affected area before use and dry thoroughly. Apply a thin layer of medication to the affected area and a small amount to the surrounding area and rub in gently. Apply this medication to the affected skin, usually twice a day or as directed by your doctor. Rub the medication gently into the affected area, usually twice daily in the morning and evening or as directed by your doctor. The length of treatment depends on the type of infection being treated. If you forget to use this medication, use it as soon as you remember. If it is close to the time for your next dose, then skip the missed dose and continue with your regular dosing schedule. Do not use extra medication to make up for the missed dose. When using Econazole foam, it is important to store it at room temperature and keep it away from heat. It should not be refrigerated or frozen, and always be sure to keep it out of reach of children and pets. When it comes to disposing of the product, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, the product should be discarded properly when it is expired or no longer needed. It's a good idea to consult with your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.